Okay, class, welcome to week 3. All right. I am recording, I am sharing. All right, let's go. I just want to first start off and say that I'm really impressed with the work that you guys have been submitting so far, and I've enjoyed reading your discussion board posts and even those that have already submitted assignments. I have full confidence that you guys are going to be great in this field. I do want to show you on the very beginning here, it says assignment instructions and grading criteria. Yes, read the syllabus, but also here on this page is every assignment in detail. And so I encourage you to use this as a guide for your assignments. Let's go ahead and pull up the discussion board posts. Make sure you read this in its entirety and pay attention to the word count. So I'm not going to mark you down, those that went over the word count last week, but pay attention to the word count. The reason why word count is important is because in this, when you get to this level in academia, it's important for us to be very concise in our words and in our writing. For those of you that are external processors like me, who are long-winded, it can be hard and challenging to kind of narrow down what we're trying to say. And so that's the purpose of these word counts, is so that way we can be very clear and concise and kind of summarize what we are reading. And so this week, I'm not going to mark you down, but next week you will be marked down if you go above the 250 word count. Now, I'm not rigid. If you go 252 or 260, that's fine. Just really try to keep it close to the 250. You can't go 100. It needs to be around the 250 word count. The other thing is, one thing that you will find is a lot of people have opinions, and opinions are valid and they are important. But in this level of academia, a lot of what we say needs to be informed by research and by the literature and by evidence. Because sometimes what we think is just our own biases. We're seeing it through our own lens. We're using our experience, our background, our upbringing, the way that we were raised, our culture, all that influences how we interpret and see things. What I want us to do is I want us to make really informed decisions that is more objective based on what we're reading in the literature and through the lectures. And so try to have your posts be backed by the research, literature, and evidence for what we're reading. Now, there will be times in the posts or the prompts where I do want to hear your thoughts, and I do want you to bring more of your personality in and more of your upbringing and how your culture influences that. There's definitely time to integrate that when the question prompts it. The other thing is I want you to really digest and dissect your colleagues' posts. We don't want to put just good job, love your post, but kind of wrestle with it. We can challenge our colleagues in a very respectful way. I encourage you to do that. I encourage you to ask more questions, to expand on some of the posts that your colleagues put, maybe even disagree. It's very healthy to disagree, very healthy to disagree in an appropriate way. So I encourage you to do that for the discussion board posts. Okay, so now let's go to week 3. Here we are. So I talked about the discussion board post. Let's go ahead and dive into the reflection paper. So the reflection paper, I feel like it's pretty self-explanatory. I don't think anybody's going to need any help with this. But if we look at it in detail, this assignment really is to get you just to think about these models. One thing that you will find being in our profession as a counselor is we bring ourselves. We can't help but bring in our personality, our strengths, our weaknesses. And as you have learned about Carl Rogers, It's all about congruence and being real and authentic. The best gift you can give yourself and your clients is this gift of awareness. Because we're not perfect, we are human, we come with our flaws. And so it's just being aware of it. So this purpose of this reflection paper is just to create awareness. I want you to talk about how do you see your personality fitting with this model. For those of you that are very analytical and analyze, and you love to give direction and you love to give feedback, and are a cheerleader and are a coach, it will be kind of hard for you to sit back and to not give advice and just to ask questions and allow the client to come up with the answers themselves. But that's the purpose, is just to raise awareness with your own personality and your values and how they align with the theory. So think about the specific theory that we talked about last week, and then you're going to follow these prompts to help you finish the assignment. And so follow these 3 prompts right here. And then also reflect on how the theory aligns with biblical principles, or if they contradict biblical principles. And then please pay attention to the grading format, the rubrics. APA formatting and grammar is essential in this field and in this class. And so just make sure that you are following that. Okay, let's go back to the other assignments. Here we have the case vignette. Miss Helen. All right, here is the definition or the breakdown of the assignment. And so what you're going to do is you are going to take Helen, follow this format, and you're going to conceptualize her case through the person-centered theoretical model that we learned last week in class. And so what you're going to do is you're going to identify the client. So the client is Helen. I don't want to give you the answers here, but I'll prompt you. And is the identified patient a couple, individual? Is it a family unit? Helen, is she individual client? And then her demographics, if it says it, her age, ethnicity, gender, and then your presenting problem. So how we identify a presenting problem is a client is going to come to your office and start telling you their issues through a story form. They're going to start kind of like rambling and talking about, you know, my boyfriend this, my husband this, we're fighting, my niece, my nephew, my daughters. And so we are trying to train our brain to think of everything through a symptom clinical lens. Everything's a symptom. Resistance is a symptom. Clients not talking is a symptom. Clients overly talking, overly sharing. So we're going to start to look past the behavior. And as somebody who is being trained into analyze behavior and to analyze the mind and the mind, brain, body connection, we're going to be analyzing and saying, what exactly are they trying to get out of counseling? Why are they really coming into counseling? And so, for example, let's say you have a couple, and the couple, they talk about their fights that they're having, and they keep getting frustrated with one another because they're feeling disrespected, that the other partner isn't shutting the bathroom door when they go to the bathroom, or they're not closing the cabinet doors in the kitchen, or they're leaving a mess on the floor. That's not the presenting problem. That's what they're coming into and complaining about, but we're training our brain to look at it through a clinical lens. So in this case, the presenting problem would be the couple is having difficulty communicating expectations. Why are they struggling with this argument? Maybe the couple, the presenting problem is they need conflict management techniques. They need to learn how to cope with their own frustrations and their own emotions. So that's the presenting problem. So by able to read through the story and pull out, what are they coming to counseling for? We decrease anxiety, decrease depression, increase conflict resolution skills. It could increase frustration tolerance, increasing boundaries. That's kind of what the verbiage we're looking for. And then here we want some background information that is related to, that you think is important to the client's presenting problem, or even information that you think contributes to what's happening with the client. So summarize that. And then if you identify any strengths, so identify strengths and limitations in the client, and some diversity issues, some incidences that you're reading that may be just relevant for their culture. We need to be able to see the world through the client's lens, through their cultural lens. And so being very aware of cultural differences and being well versed in diversity is important in our field. So being able to point out that diversity issues, and then it says here to use the template as a guide, really highlight guide. You don't have to fill out the template and submit it. The template is just there for you to use as a guide. You don't have to use the template. You can use the template just as an additional resource to help you, because what Gayheart does is in her template, she kind of prompts you and tells you little things to look for, and then gives you verbiage to use. And so it says use the template, just so you know, it's a guide for you. Okay. Here we have the case vignette, Helen. I'm not going to open her up yet. Let the suspense stay there a little longer. But that is Helen. And then let's go ahead and look up here the case vignette worksheet. So here's when you're going to identify. So here you're going to put the theoretical approach you're using, which is the one that we studied last week, the summary of the presenting problems and symptoms. Here we go, talk about her history of symptoms. And then from the theory perspective, from the theoretical framework, per this theorist, what are some initial treatment goals? We want to make sure that we don't just put a random treatment goal. The treatment goal has to align with the theoretical approach. And then 3 interventions per this theoretical approach. And then what are some cultural dynamics and influences to consider? So that is the case conceptualization form. Now let's go back and talk more about the role play. So for the role play, I know that we have kind of an odd number, and so I did give you guys autonomy how you wanted to figure that out. Why can I not pull up? Is this it? Here it goes. Here it is. Okay, great. So this week, you're going to be getting into a triad, and then you're going to have a therapist, you're going to have somebody that is observing, and you're going to have the client. So each person is going to practice using this theoretical approach. And in about 20 minutes, you're going to record yourself practicing these clinical skills, practicing using the theory. I am not looking for perfection. You can mess up, jumble on your words. You can get stuck. You can pause. Totally fine. I'm just looking to see if you're able to recognize some of the clinical skills that are needed from this theory and just practice it. It's like when you're learning a new skill. And let's take the piano for an example. When you're learning to play the piano, you're not going to get it perfect the first time. You have your teacher who is sitting next to you, helping to coach you along the way. That's the purpose of this, is just to start practicing the skills in a therapeutic session. Like you're practicing the piano, you will hit wrong notes, you will make a mistake. That's part of the process. You will not get marked down for making a mistake. or for hitting the wrong notes. But I do want to see you just trying to incorporate some of those interventions from that theory. And so, as I mentioned last week, clients, please don't overshare. Please don't talk too much. Really let this be the place where the therapist shines. And then the observer is going to kind of take note and write down what you see. This also is a good way for the observer to kind of listen for the clinical skills that are being utilized in the session, and to be able to kind of pinpoint and highlight and track and identify some of those interventions. So you're going to fill this form out. The evaluator, and so per triad, I only need the one observer to upload this, and then also for the video to be uploaded. So everybody is going to practice being the therapist, utilizing this theory. Everybody is going to then, from that triad, one person is going to submit it on Moodle. I hope that makes sense. If not, please email me and I can clarify again. And so here is the grading criteria for the role play, 20 minutes. And then it could be on Zoom, Google Meets, whatever you decide. And just make sure it's uploaded that we can see it. I prefer to be uploaded on YouTube, it's easier. And then the worksheets. Okay, so that is it, guys. That is the assignments for this week. As always, if you have any questions, let me know. I am more than happy to do a live Zoom class for you all. If you just all want to kind of get together sometime in the next week or so and have a live class where you ask me more questions, and we can even do some role plays ourselves, I am more than happy to. And that's it. Have a great week, guys. And I'm going to try to end this recording. All right, take care.